Hi, I'm Dr. Patty Barch. I'm a traditional naturopath and founder of Naturally Unbridled Wellness in Onalaska, Wisconsin. The information presented here is for educational purposes only and is not intended to diagnose, treat, cure, or prescribe for any disease or condition. Please consult your healthcare provider when making wellness choices. That being said, today's video is about osteoporosis and osteopenia. So just a little nutshell stuff for you real quick. So osteoporosis and osteopenia are basically different levels of the same condition. So osteopenia is when your bones are on the weaker side, and then osteoporosis is, they're pretty bad, like getting pretty brittle and you're at risk for fracture. So anyways, super common condition, and I'm going to just give you some information about the causes, what the medical model does about it, and what you can do holistically. So one of the causes of osteoporosis, osteopenia is hormones. A lot of times as women enter the menopause years, estrogen levels decline, and then bone building starts to fade away and you get weaker and weaker bones. One of the things that also happens is if women it's more common in women, it can happen in men, but super common in women. If they're not doing any kind of weight-bearing exercise, the bones respond to weight-bearing by getting stronger to hold the weight. Body's brilliant that way. So if there's no weight-bearing exercise going on, the bones get weaker because they don't have so much to support. Vitamin D plays a key role in the mineralization of bones, and so we have a rampant issue with people not having enough vitamin D in our country. And then there's sort of this predisposition in scrawny white women. So if you're petite, pale woman with a slight bone structure, you're at high risk for osteoporosis. I know the women in my family are the incredible shrinking women. They get shorter and shorter over the years. So if you are diagnosed with osteopenia or osteoporosis, the medical model is going to make some recommendations for some prescriptions for you. But there are some challenges with those prescriptions. I invite you to research the side effects. So just type in the computer side effects of whatever the drug they're prescribing for you is. I like to go to a site called RX, so for prescription, rxlist.com, and there's a search box there. Drugs.com has it too, but you can search side effects. So an important thing to know about the osteoporosis drugs is that they do reduce hip fractures, but because they change the way your bone structure is remodeling and rebuilding, there's actually an increased risk in femur fractures. So your hips are better, but your thigh bone will break. The other thing that's really horrible side effect, and they're like, call your doctor if you're experiencing jaw pain. It's not uncommon for the jawbone to disintegrate. And it doesn't come back, like it just disintegrates. And that's listed right in the side effects of those drugs. And there's many other side effects as well. So it's important to be aware of any side effects of any medication that you're taking. Other information that the medical model will tell you is to eat more dairy, which is a bad idea. Pasteurized dairy has all of the enzymes destroyed, so it's very difficult to digest and therefore difficult to extract the nutrients out of that food. Another thing that tends to happen with age is digestion can get weaker, and so your ability to access the nutrients in your food can go down as well. And then dairy, because it becomes difficult to digest, your stomach needs to create some acids, your body's going to respond to the acidity, just like if your lawn is acidic and or your garden is acidic and you would add lime, which is calcium carbonate. Your body's going to take calcium out of your bones to neutralize the acid that has been generated from eating the dairy. Right? One of my first blogs that I ever wrote more than 10 years ago was about how dairy products are not the solution for bone health. The other problem with the medical advice that they'll give you is they'll tell you to take calcium. Just calcium. Bones are made up of a collection of minerals, and minerals all work in a symphony together in your body, and they need to be balanced. So they don't tell you that certain forms of calcium are really unavailable to the body, like calcium carbonate, which is in the vast majority of crappy calcium supplements. So that's really difficult to get into your body. And then if you don't have the right magnesium and copper and selenium and zinc and all the other minerals that are involved in bone building, then you end up just with like really stressing out your kidneys with lots of crappy calcium. So not all calcium is created equal. So you need to make sure that you have optimal digestion so that you can digest your food properly and access the nutrition from your food. And there's tons of minerals in healthy food that comes from the earth and comes from animals. Exercise is important. As I mentioned earlier, weight-bearing exercise is really good for bone strength. Now, there are some supplements that can be really helpful, and I've been working with clients with osteoporosis and osteopenia for years. And for a long time, all I was able to do was stable disease, which is okay, right? Keep it from getting any worse. So we were able to do that with some supplements. But a few years back, I added pulsed electromagnetic field therapy to my practice, and then I expanded some of my nutritional support for these clients. And I've been seeing increases in bone density. One client had a 7% increase in bone density from one scan to the next using my program. So the pulsed electromagnetic field therapy is actually technology that's used by NASA in the spacesuits that the astronauts wear, because when the astronauts get out of the atmosphere and gravity goes away, remember the importance of weight bearing on bone modeling, the astronauts would come back to Earth with osteoporosis because since there was no pressure, no stress on their bones, their body's like, oh, I don't need to keep these bones. Bones are, people think of them as being like they're there and they're done. They're constantly changing. You're constantly rebuilding bone. That's why you can get a broken leg and it'll heal eventually. But anyway, the astronauts started adding pulsed electromagnetic field therapy at the frequency of 7.8 hertz, which is the frequency of the Earth, to inspire the body to keep those bones strong, and it worked great. So when we added the pulsed electromagnetic field therapy with a bone supplement, we saw great results. And then I got the idea one day, like, oh, wait a minute, this makes sense. Collagen is like the glue that holds body tissues together. So once I started incorporating collagen in my recommendations for clients who are trying to rebuild bone, we really started to get these like 7% increase in bone density. So the combination is a nutritional supplement designed for bone health. We have a few, but here's two. One is called OsteoBen, and this is kind of the basic one. That's a really good product. Vitamin D, calcium, magnesium, zinc, genistein, and vitamin K2. Really, you need to have vitamin K with vitamin D for proper calcium applications in the body. And then OsteoForce, which is kind of the stronger one. This has additional like copper, zinc, manganese, vitamin E, and boron, a few other things. So those are two products. And then the whole body collagen. I've been taking this for years. Every connective tissue in your body has a lot of collagen in it. So skin, ligament, muscle, bone, all those things need collagen to build. So that's a little lesson in osteoporosis and osteopenia and some of the things that you can do to naturally support your body in having healthy bones. Thanks. Have a healthy day.